Everyone. Very excited to be moderating this program. People who may not know me, I'm Dr. Ramali. I'm one of the consultants in intensive care unit. So we have got an exciting program today, and we all know we are waiting to welcome the holy month of Ramadan. Just to give a quick note on it's important. The scholars have said the month of Rajab is the month for planting, the month of Shaban is the month for irrigating the crops, and month of Ramadan is the month of harvesting the crops. So we are all excited, and it's important, inshallah, as the title of this program says, to do it properly and to reap the maximum benefit. And we are grateful. So many of us are very healthy, and Allah has given us that blessing, and hope we may continue to lead a healthy life and take part in Ramadan in future. And also there's another population group who have got diseases, and since the medical field is developing rapidly, and there are so many new technologies, new medicines, and people who may have been taught it's unsafe to fast in the past may be able to fast now. So our aim is to help that sort of patients and people. It doesn't mean that we are going to forget the healthy ones. So to kickstart this program, inshallah, I'm going to invite Sheikh Ahmad Yasir to start the program with the Qiraat, please. Recitation of Qiraat. Mr. Sheikh Ahmad Yasir, please.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم لقد كان لكم في رسول الله أسوة حسنة لمن كان يرجو الله واليوم الآخر وذكر الله كثيرا ولما رأى المؤمنون الأحزاب قالوا هذا ما وعدنا الله ورسوله وصدق الله ورسوله وما زادهم إلا إيمانا وتسليما من المؤمنين رجال صدقوا ما عاهدوا الله عليه فمنهم من قضى نحبه ومنهم من ينتظر وما بدلوا تبديلا صدق الله العظيم.
Jazakallah khair, Sheikh Ahmad Yasir, for that beautiful recitation. Okay, so the next part is, first of all, warm welcome to all the participants who have joined via Zoom and then also via Facebook. So as you all know, it's been live streamed on Facebook. And this program is actually organized by World Federation of WFSLM, Sri Lankan Muslims, and with the help of a lot of media partners in various countries. And Jazakallah khairan for everyone for that. And the topic today is safe fasting in chronic health conditions. So as I told you earlier, it's very important because, as you all know, there is a sizable amount of Muslim population, and we have been, prone to health conditions where, when it comes to fasting months, in the month of highest spirituality, we have to have some guidance or some sort of guidance to do it safely. So since COVID pandemic, I'm sure you all remember, pandemic hit first, and within a month or two, the Ramadan came during the first. So the interest in health became much more intense for everyone after the COVID pandemic. So and there are various guidelines prepared by various institutes. So these, whatever we are going to say today, we are going to be talking in terms of research-based or experience-based medicine. So in some countries, research has been done on fasting patients to see the effect of medicines or health conditions. So our speakers are very, very eminent in their field and their experience. So that is what next to come. So before that, I would like to warmly welcome our chairman of WFSLM, Mr. Rizwan Wahab, to give a small introduction and a welcome talk, please. Over to you, Mr. Wahab.
Thank you, Dr. Ramali. Assalamu alaikum, everyone, for their cooperation and participating in this very important event of the World Forum calendar for the year. And firstly, I thank Dr. Ramali and his team of experienced doctors who are going to enlighten you on the topic of safe fasting for our community and also for all those who are fasting. My name is Rizwan Wahab. I'm the chairman of World Forum for Sri Lankan Muslim. We are a forum which has been established many years ago, and we are spread in over 23 countries. And the World Forum, just to give you a brief idea what it is all about, World Forum is for the Sri Lankan Muslim expatriate worldwide. There are quite a few co-opted members from Sri Lanka also joining in the World Forum. World Forum itself is working with a number of teams, which entails on different area of community service. Briefly to tell about, these are the education, gender equality, youth, climate change, and so on and so forth. The teams are working with a number of projects related to Sri Lanka and other parts of the world to support our community. This is one of those vision of the World Forum, mainly on the education side. We have done a number of projects on that, especially scholarship program to the advanced level student and so on. And the climate change wise, we are going on with a lot of activity, and all the other teams, the gender equality and the climate change and health and well-being team, are all progressing well with their own activity. That is one of those major part of our work. Apart from enlightening and bringing in awareness program worldwide for our community and community at large, psychology, parenting, and so on and so forth by the events team. So these are program World Forum is motivated by supporting our community. Secondly, the World Forum is a strong lobbying force for the world. So whatever issues and concern of our community, whether in Sri Lanka or any part of the world, World Forum will step in and address the issue. So we have done in the past for a number of years now since we inaugurated, and we'll keep going supporting our community. So the Sri Lankan community is mostly with all these issues and concerns right now in the country. World Forum is stepping in, consulting with many areas of concern for our people, and we have addressed those by meeting the relevant authorities in the government. So that is as far as the strong lobbying force. The other major factor of the World Forum is that we are focusing on registering with worldwide large organizations such as OIC, World Muslim League, and the United Nations. So these are another area the World Forum will develop soon, so that we will be established in such a manner and take our rightful place in the world arena, so we are able to support our community and community at large. So this is a Sri Lankan organization. So thirdly, that we want to give back to our country, our knowledge, skills of our professional intellectual who are with us in the World Forum. They will give back all their skill and knowledge and intellectual capacity supporting Sri Lanka. So we are presently embarking on number of activities such as supporting the investment program for economic in June. So we have a large investment forum taking place in London, where over 200 to 300 business people will participate and invest and support us in Sri Lankan economy. And the education side, we are also working with the number of associations in the United Kingdom and other parts of the world, and preparing a number of white papers to support our education team. So these are the main things. So any members who are joining in today, the conference are, if they are expatriate community, domicile in the country they are living, they are welcome to join and contact the Secretary General of the World Forum or the membership team, and we are able to send you the membership package. Any question on the World Forum, if you have, end of the program, you can ask me, then I'll answer it. In the meantime, let's focus on the important program for today. Thank you, Dr. Ramali.
Thank you very much, Chairman, for that brief talk and introduction about the WFSLM. Right, so now to the main event. So before we start the main talks, I would like to give you all some housekeeping rules. So there'll be two main speakers talking on the subject, and Dr. Aseef Yehiyan and Dr. Ayesha Cader are going to be the main speakers, and Dr. Aseef Yehiyan is going to do the talk first. So our aim is to give time for questions and keep the talks as briefly as possible. So to run the program smoothly, I would kindly request participants, if they want to send their questions through chat box, they are more than welcome to do that. The tech team is keeping a close eye on the chat box. Then also, if someone wants to ask a questions live during the program, please use the raise hand function in the Zoom, and then the tech team will unmute you all, and then you all can ask the questions. In the meantime, I will in between try and drop some or give some tips, because we shouldn't forget the healthy population as well, to during Ramadan, how to be safe and then and do it properly as far as health is concerned. So without taking much time, I have the pleasure of introducing our first speaker. He is Dr. Muhammad Aseef Yehiyan. He is a colorectal and a general surgeon. He works in UK in Blackpool Hospital. So he's going to be doing the first talk. Can I warmly welcome and ask you to start your talk, please, Dr. Yehiyan. Thank you very much.
Assalamu alaikum wa rahmatullahi wa barakatuhu. Innal hamdulillahi nahmaduhu wa nasta'inuhu wa nastaghfiruhu wa na'udhu billahi min shururi anfusina wa min sayyiati a'malina. May yahdihillahu fala mudilla lahu wa may yudlil fala hadiya lahu. Wa nashhadu
I think we might have lost his connection.
Dr. Yehiyan. Yeah, I have a feeling we may have lost the connection. I'm going to give a few more seconds to see whether he can join back. Otherwise, we'll have to ask you to start to us, but we'll give him a few more.
Sure, no problem. Oh, he's back.
Yeah.
He's back.
Yeah, I'm sorry about it. Yeah, I think because this background recording message keep on coming, so accidentally clicked it. All right, okay. So thank you very much, Dr. Ramali, for the introduction. I'm really happy. First of all, I know this program is meant for the international audience from various parts of the world. Mainly we Sri Lankans if they are listening, if they want to ask questions in Tamil or Sinhalese language, I'm more than happy to answer them. So be comfortable for yourself. And as I already mentioned, and then as Dr. Ramali says, I think Dr. Cader also would agree, we should give them so much time for questions, particularly they have their own concerns to raise, because there were loads and loads of talks during this Ramadan. And there were, even last week, there was a program with physicians and senior doctors. So the information is available. The knowledge is like a sea. However, we need certain things we need to particularly understand. So what I'm going to talk is in relation to my own experience and my specialty. I'm sure particularly Dr. Cader is much more experienced in the physics, internal medicine related issues like heart, lungs, kidneys issues. First of all, I always tell, because I have done these kind of programs before in Ramadan, I always tell my humble request, please do not take this only for the Ramadan. Every piece of advice and the guidance or the good points are throughout the year. But the Ramadan gives us a very good opportunity to remember these things and take it from there. So what I would like to tell is I'm gonna, so the tech team, can they see me clearly? Yeah. Anyway, it's all right. So the first thing is, I'm gonna briefly give certain, thank you. Yeah, now I can see myself, yeah. So the first thing I would like to tell you is, a lot of people call and ask whether we can fast or not. So the first point of my speech, the talk is whether we can fast or not. And remember, this is for my colleagues, friends, and we doctors have to be very, very cautious when we advise our patients, not to fast, because we are taking the full responsibility of them being not being fasting. But if we say patients or relatives, friends to fast, from there, fasting or not is their responsibility. It's up to them. So I am telling in my own experience, and I worked in Sri Lanka and I worked in Oman, Sultanate of Oman, in Arab countries, and I'm working in the UK now for 6 years now. In my own experience, very, very few patients can be excused from fasting. There is hardly a major diseases, very few, we'll talk about it, probably Dr. Cader might know that. Very few people cannot fast. They have to excuse themselves from fasting, but majority of us can fast. Because what I'm saying is, generally, if you look into even the Islam, non-Muslims or the other faith people, they are now practicing intermittent fasting. They are also fasting. The fasting has loads and loads of benefits. And I would like to, with permission, quote these the research done for over 25 years in Johns Hopkins, USA, about this intermittent fasting. Loads and loads of medicine you can find in Google. Loads of benefit in intermittent fasting. We do fast. We are sleeping overnight. And we wake up, we are fasting. Every day we are fasting. When we are having a busy schedule, we are fasting. We don't have our time. If you look back centuries ago, human beings used to eat one meal a day. Actually, Romans and the Greeks, they had only one meal. But later on, the Industrial Revolution, Englanders brought out the breakfast concept and then 3-meal concept. And I would like to remind, human beings are the only species we do eat when we are not hungry. If you keep on remembering ourselves, and then all the animals, farm, wild, your pets or anybody, when they are hungry, you feed them, and they ask for it, you feed them, they eat. But unfortunately, we human beings, we try to eat when we are not hungry. That's not good. And not only for Ramadan, I'm telling you, for the whole life, every single day of our life, the healthy part of our life is dependent on two things. Always when the patients ask about questions, I look into two aspects of their life. One is sleeping pattern, one is eating pattern. Every speech of mine, whether I give it in the local community or whether I'm giving in the international, whether I'm writing papers, I always focus on the two habits of a human being that will bring out all these diseases. I think probably Dr. Ayesha will talk about it. So remember, so we eat when we are not hungry. Our food, the fed status of our body, when we eat like carbohydrate or rice meal, it lasts for 3 hours, average. Then what happens? The one we stored all these years, the fat will burn for another 3 hours. Then only we are going to lose our protein and other thing. We are suffering for energy, 6 hours. But how many of us wait? We have a break in between the work. We have a tea time and we have oh, I'm tired, so I'm going to have a drink. You have a sugar drink. If you are tired, you should take a rest, not to eat. If you are tired, you stop working. If you are running, yeah. So if you are thirsty, yes, the water is the best food. Prophet ﷺ has already told us, and we have plenty. He has I think he filled his stomach with water more than anything in his life. Because the hunger comes with the hormone ghrelin when the stomach distends, when this is empty. When it is distends, it will go down. Remember, the hunger pangs are very short lasting. You will get the hungry and then immediately you will go back and then you will get used to it. So you train yourself during the Ramadan that for some reason, the host, I'm being unmuted. Tech team. All right. So my other thing is, so the main reason the main point is everybody can fast, in my opinion, unless there are certain diseases. I'm going to talk about it. Secondly, then I have talked about the benefits of the fasting. There are hundreds of benefits. We can all find out in so many websites, even people who are specialized in medicine, internal medicine, they can tell you it's clean, avoiding cancers, avoiding weight, heart diseases, all the diseases. Now coming to particular diseases, which are in relation to my specialty, for certain diseases, specifically the people who are going, please, if you have an elective surgery booked, like hernia or gallbladder or anything electively, please do postpone. There will be benefit, there will be barakah in that. Do not think, oh, I might get a later date, I might get this, I might get that. No. During the fasting, if you have an elective surgery, please postpone and do your fasting, because you cannot have an excuse for that. But if you are under an emergency surgery like appendicectomy or bowel surgery, if you are recovering, I'm not going to go into religious excuses, because there are so many religious scholars, they would agree. Islam has permitted you not to fast for several reasons. Please obey those things. So if you are in an emergency surgery, you cannot fast. That's fine. Coming back to the other condition, very, very, very common. Everybody asks, I'm having gastritis. When I fast, I get gastritis. I am telling every single patient, have you undergone a camera called upper GI endoscopy camera test? And then have they found out gastritis in you? Have they not treated you? Have they labeled you? You are high risk of bleeding from your gastritis? Yes, then you have a slight risk of fasting. Everybody else, in my opinion, 97% of our population thinks they have gastritis, but they don't have it. There are hundreds of reasons why you get gastritis or the acid reflux. Why? You are obese, or you are overweight, you are a smoker, you are drinking caffeine, or you're drinking or eating just before the bed, you're very oily, fried, processed fast food eater. Have you considered these all risk factors? Have you really addressed on those? You're not. You're smoking until just the beginning of the first day of Sahur. And then immediately after breaking fast, you are going out for a puff. then how can you excuse yourself saying gastritis? In my opinion, if you have undergone a camera test that has found out Helicobacter pylori or the bacteria, that has found out you have a very high risk bleeding ulcer, you have been given omeprazole or the acid suppressing medications to take it seriously, religiously twice a day, yes, I would say you have an excuse, but still you could consider, adjusting your dosage. All the rest of the population, please do fast. You are not going to get your gastritis aggravated by this fasting. And if you want, please, if you have Helicobacter pylori or the bacteria before, you get it treated 10 days or 14 days course. You treat and then you are clear. You cannot have an excuse for not fasting. So what I'm advising is the people who have truly bleeding ulcer or risk of bleeding, the people who are using aspirin, clopidogrel, or high-risk bleeding medications, I mean anticoagulants like warfarin and things, then of course you have to talk to your doctor just before the fasting. So all the gastritis patients, please, you can fast, in my opinion, but avoid smoking, avoid fatty meals. We will give you some tips and advices for the food, but everywhere you can find what is best to eat. You have hundreds and thousands of posts in your WhatsApp, in your Facebook, in your emails, in your Google. You have hundreds of things, but how many of us taken as seriously? We are still running behind all these the so-called samosas and fried stuff. And then we hurt ourselves during the fasting. Secondly, about because I'm into bowel surgery, I create a lot of I involve in care of stoma patients. The stoma is you bring the end of the bowel through the tummy. If you have a stoma, there's no excuse for fasting. You can fast. There's no reason you cannot fast, because what we give sometimes for stoma people is to thicken medications to reduce the stoma output. That is, artificially we are creating constipation. When you fast, because your lack of water, you may get constipation. So that's a treatment. So people used to call me, oh, I'm having a stoma. Can I not fast? Why? You can't fast. You can fast easily. And the people, I very hardly take medicines to open the stoma faster. So in general, what I'm advising is, they are in my specialty, probably Ayesha Cader would explain more. In my specialty, I have not come across a serious consideration to avoid fasting. Fasting is best, but how you are going to fast is a problem in our community. Fasting is best for everybody, all the world, but how we fast is the most worrying thing. The amount of food we eat for suhoor is horrendous, and the type of food we eat, type of food we break our fast with, those are really worrying and saddening. How many decades gone now, still we are in the same old practice. How many of us we have lost? May Allah all of us to go through this Ramadan and complete the Ramadan 30 days and enjoy the Eid. That's my dua, because we have not even reached that. But my advice is, consider all the tips and advices we are going to give throughout the program. And then in my key part, the end of the talk, I've thought of giving advices, plenty of water and water-rich food. When you when you are breaking your fast, please do not start eating your biryani or fried or whatever you stuff, because that habit has to be stopped. The date is one of the wonderful things, because it has got so much sweet and so much sugar and energy, and then so much minerals on it. The best fruit to start your fast. And then you have some water and some fruits, juicy fruits with water-rich fruits. Then you go and do your prayers, wait a little bit, settle your time, then come and have your meal, which is also not very heavy. So, and similarly, reduce your salt intake. Absolutely no salt is the best, but you cannot, but so you reduce the salt intake. So that will alleviate your thirst. And remember, there were some people worrying about, oh, I was advised by doctor to take 3 liters of water, 2 liters of water. How can I have it in Ramadan? plenty of time you have. I would say 2 liters of water can be easily covered during your nighttime. Breaking fast, 500 bottle, finish it, and then you go for Tarawih. After every 2 rakat, have a sip, you can finish another 500, come back, another 500, suhoor, another 500. 2 liters can be easily covered. That's more than enough. And a human being, minimum 1,500 and maximum 2,000, 2 liters water can be easily drunk during the eating period of the Ramadan time. So there's no excuse. So in summary, please practice the beautiful, best eating habit during Ramadan that will protect the Ramadan, that will protect you and your family as well. And everybody can fast. Fasting is a best medicine, not only during Ramadan, throughout the year. Try to practice intermittent fasting like Thursday and Monday, like our Prophet did. And that's best, beautiful, and best for all the health. And I will stop in here, and then I will really give more chances for the questions. I know there will be loads and loads of questions in everyone's mind. So you can put up in this chat box, or you can send it to Dr. Ramali. I'm more than happy to answer in any language. Jazakumullah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.
Jazakallah khair, Dr. Yehiyan, for that wonderful. And what highlighted was your advice was not just for Ramadan; it's for whole year. And we should take this opportunity to carry on with this advice after the Ramadan, and I'm sure we will feel much better in everything we do with that sort of good eating habits, from mental health to physical health, better sleep, everything in one. So thank you so much for that. And as you said, we are going to keep the questions till end. And also, can I reiterate what you said? I'm lucky to have people who can talk in both languages, three, Sinhala, English, Tamil. So please feel free to ask any language. Also, before I forget, can I also say the advice is usually general. So some patients will have to be given those advice in individual basis, depending on their medications and things like that. So you all may feel a bit uncomfortable to ask these questions. So I'm happy to stay after the program for about 15-20 minutes if you want to privately ask any questions. And I'm sure if time permits, other speakers may. I don't know how busy the schedule they have. Please feel free to ask that question privately. We are more than happy to help, because as I said, as professionals, it's our duty as well to educate the public, and that's our responsibility as well. And also, as Dr. Yehiyan said, we are strictly going to be advising on health issues. None of us are religious scholars, so if someone has to check anything when it comes to religious aspect, please make sure you double check with one of our learned scholars in the community. And as he said, it's a individual's decision to make sure you fast or not. We can only advise, but the good thing is, as Dr. Yehiyan said, majority of us can fast safely. But the important word is safely, how to do it. And there are various ways of doing it by adjusting medication. So Dr. Ayesha Cader will be doing that talk. Before I get Dr. Ayesha Cader to talk, as I promised, I'm going to be dropping off some health tips in fasting. So my first will be, make sure you all avoid constipation during fasting. So make sure your diet is high fiber diet at Sahari and Iftar. So I'm sure Dr. Aseef Yehiyan has already told about it. So fibers, yogurt, it's a great way to keep your healthy bowel moving. And also cereals is a good high fiber meal, and fresh fruit and vegetables. So bread, brown rice, starchy vegetables. So that will help you have a good bowel motion, and constipation. You don't want that during fasting. So that's my first tip. And this brings me to my next topic. So I'm delighted to bring, we are lucky to have Dr. Ayesha Cader. She is assistant professor in cardiology. She works in Dhaka. She works for Ibrahim Cardiac Hospital and Research Institute. And she's been busy today, just got out of the cath lab. So grateful to you, Dr. Cader, and spending your valuable time. And over to you, Dr. Cader.
Thank you very much. So I think my screen isn't, yeah, I think this will have to do, sorry about that. I have some slides, but some of it might be technical because I put them together for another talk as well, but it's mostly also catering to a lot of patients, cardiac patients, those who might have diabetes, those who might have chronic kidney disease, and also about adjusting their medications. And we know that patients with heart disease, my background is cardiology, so that's what I'll have the most information about. They also have often coexisting diseases like diabetes and kidney problems. And these conditions can interact with heart disease. So it's essential to look at the whole patient and not just one only, and look at the whole set of medications. And this is something that we advise patients to do. Also, before fasting, as Dr. Yehiyan pointed out, the vast majority of patients can fast, but there are cardiac conditions that preclude fasting, which I think are important to know and which I will highlight on. But even within most of the cardiac conditions, it's safe to fast with the correct adjustments prior to Ramadan. And it's important to remember that fasting can affect the cardiac disease conditions as well as some of the medications. So the adjustments have to be made to both. And also it's important to consider the climate and the country and the season as well as the duration of the fast. So if it's long hours, say if you're somewhere in the Northern Hemisphere in the height of summer, it might not be as safe to fast as say during winter. So cardiac patients also take a lot of medications. So we have to know how to adjust the specific time and dosing schedule. And also it's important to know that a lot of these medications, particularly what we call water tablets like Lasix, which we give patients who have kidney disease, which we give patients who have swelling and breathlessness, which we call heart failure. All these patients are very often on water tablets, and by emitting water out of the body, you're essentially also lending yourself to some degree of dehydration. And fasting itself, where you're refraining from taking water, might potentiate dehydration. And this is why it's important to, as Dr. Yehiyan said, make sure that you take plenty of fluids during the duration that you are not fasting, particularly for patients who are on these medications. So as I said, these medications can lead to dehydration. Also, most cardiac patients will have medications that will reduce blood pressure. So it's important to also make sure that you know your regular blood pressure. So ideally, cardiac patients preparing for Ramadan should start maybe 1 to 2 weeks before, not just the day before, where they check their blood pressure, they know their baseline blood pressure, and are able to adjust the medications accordingly, because cardiac medications in a fasting patient can lead to some degree of lower blood pressure, not most of the time. And of course, if the patient has an acute kidney problem, fasting dehydration itself can worsen it. And therefore, that is something that I'm not an expert of, but I would have any patients who have kidney issues wanting to fast, particularly with other conditions, also see a nephrologist prior to Ramadan. But having said that, despite all of this, it's very, very important to note that not taking these medications are equally dangerous. And we can't stress that enough, because as much as we all want to fast, as much as we all want to make sure we do our good deeds, it's also important to make sure that we're healthy. And it's not a good idea to stop taking medication saying that maybe this would happen, because if you don't take your pressure medications, your pressure is going to go high. And it is especially important in patients who are on blood thinners after a stent, because the stent itself remains open without creating further blocks because you're on a blood thinner. So it's very, very important to take your blood thinner, and also to take it on time, so that there is enough of the blood thinner in your body during the time that you're fasting, so that it doesn't sort of lead to clots and deleterious effects downstream. So these are the important points, and this is why it's so important to make sure that your medication is well adjusted, and especially the timing is well adjusted, because when you're fasting, it's not like you can say, oh, I forgot it and let me take it now. So in terms of general advice, I would advise you to consult your doctor or your GP. And what we also advise patients is to do something like trial fast. Dr. Yehiyan spoke of intermittent fasting. So maybe not 30 days at a stretch. If in preparation for Ramadan, you could try fasting every Monday and Thursday and seeing how that goes, how it affects your body, your blood pressure, and how you might be taking your medication. And prior to Ramadan, maybe a few days prior, you can start switching the medications. As I'll speak a little bit more about this, where it's relevant and possible. If it is a single dose, it's not a problem. You can take it either at suhoor or iftar, depending on the appropriate time. But if it is twice daily, it should be taken with as wide a gap as possible. So if you're taking your first dose at iftar, make sure you take it soon after iftar when you have something in your stomach, and you take it as late as possible at suhoor, so that you take it with as wide a gap as possible to make sure it's as close to 12 hourly as possible. And of course, we spoke a little bit about diet. Make sure that you have balanced meals. Beware of any food interactions during Ramadan as you are outside of Ramadan, and also make sure that you have sufficient fluids as your heart condition will allow. So who can and who cannot fast? This is a risk stratification that was originally developed actually from the diabetes guys, because they are far more advanced in these aspects than anyone else. And what this is like a traffic light signal. So green means it's quite safe to fast. So if you have stable hypertension, that is you have high blood pressure, but it's well controlled with medication, it's perfectly safe to fast, provided you keep taking your medication, because as I said, your blood pressure is under control because you're on medication. So if you stop taking it, it's going to go high. So make sure that you have a stable blood pressure on a stable dose of medications. Stable angina. Angina is patients who have chest pain, who are on medication and are well controlled with medications for chest pain. So if you have had a heart attack, say 1 or 2 years ago, and you are on medication for it, it's safe to fast. Those with non-severe heart failure. So heart failure is when the heart doesn't pump enough blood. And this parameter is, those who are familiar with it will know that this parameter is around 60 to 65% in a normal person, the ejection fraction, that is the pumping ability. So anything more than 35%, so is safe enough to fast, provided, once again, that it's well stable and well controlled on the medication. If you have a rhythm problem and you have a loop recorder in there, it's perfectly safe to fast. If you have valve diseases which are not severe, so if it is at the early stages, mild or moderate, it's again safe to fast. If you have certain rhythm problems that are not life-threatening and severe, it's also safe to fast. So the amber or the yellow, where you should not fast, are patients who have poorly controlled hypertension, because very high blood pressure can lead to certain adverse conditions, even a stroke. So until the blood pressure is well controlled, it's probably better not to fast. This is not a strict no, it's not a red light not to fast, but it's best not to fast until you have those things under control. So I think reading between the lines, this yellow box is really about making sure that you optimize your condition with the appropriate medication in preparation for Ramadan. However, any patient who has had a heart attack within the last 6 weeks ideally should not be fasting. And that is because A, your body has undergone a significant change. B, very likely you would have had a stent, which, as I said, stents are kept open and patent by taking blood thinners, and you have to be on this twice daily blood thinner on a very strict control so that your blood doesn't clot within your body. So these things are very strictly monitored and controlled. And so within 6 weeks of a heart attack, it's best that patients not fast. Also, it is during this 6-week period that patients have cardiac rehab. So if a patient is fasting, they will not be very well adapted to taking rehab. They won't be able to take their medications on time. They won't be able to do the exercises properly. So these are patients that, and once again, as somebody else also clarified, this is not a religious viewpoint. This is a research and purely medical viewpoint, that these patients within 6 weeks should probably not fast. If you have patients who are familiar with this hypertrophic cardiomyopathy, when the heart muscle is thick, so thick that it obstructs blood flow within the heart, you should not be fasting. Valve problems that are very severe, that need surgery, should not be fasting. But if you have had a surgery for your valve problem and it is more than 6 weeks since then, it's safe to fast because now you have a perfectly well-functioning valve. So all the patients who have a pacemaker, it's safe to fast. So there are lots of devices that you put into the body for different problems with the electric circuit in the heart. But if a patient is on a pacemaker, it's perfectly safe to fast because your pacemaker is taking care of your rhythm problem. But those patients who are on one of those shockers, the defibrillators, which we call an ICD, or if you're on another device which is called a CRT, these are patients that need the defibrillator to function in case they have a life-threatening arrhythmia, and they're on that because their cardiac condition is low or their heart is pumping far too low. These are patients who should probably not fast because once again, dehydration can do lots of things to your heart and your body, and so this is not a patient subset that I would recommend fasting. An absolute no are those with advanced heart failure. So if you're very breathless, you need to be on Lasix, you should not be fasting. And also severe pulmonary hypertension, because these are conditions where the dehydration, even the slight dehydration caused by fasting, which has no impact at all on a healthy person or person who doesn't have serious diseases, this can have an impact on those with advanced heart failure and severe pulmonary hypertension. So these are the two categories that we do not recommend fasting for. So what are the medications that are allowed while fasting? This is commonly asked, and what is definitely not allowed is any tablets. You cannot take tablets while you're fasting. You cannot have any rectal things. So anything that goes through your bum for fever is not allowed when you're fasting. And a nasogastric tube, which we give very severe hospitalized patients, those are routes which are definitely not allowed. And what are definitely allowed is anything that you put. So if you have a skin condition, it's okay to put a cream on you. If you have a vaccine that goes through your muscle, it does not break the fast. You can do it. And subcutaneous is a gray area because some insulins are subcutaneous. So that's something that is still debatable. Those that are majority agree that are not allowed are inhaled and also anything that goes directly into your veins. So these are generally considered to be not allowed while fasting. But any eye or ear drops, and majority of people agree that it's allowed. But important and relevant here is that patients who have chest pain will find this familiar. It's a spray that you take under your tongue. This is something that most scholars agree may be allowed as long as you make sure that it doesn't reach your throat. So if it's under your tongue, it's very unlikely to reach your throat, and it's generally a spray, so it's not something you can swallow. So this is something that's safe. So it's important for cardiac patients to know that it doesn't break the fast and you can use it safely. Because the reason I say this is because there might be some patients who don't want to break their fast and therefore won't take this medication, which is an emergency medication that you take when you have chest pains. What about patients with high blood pressure? Ideally, 1 to 2 weeks before, I would make sure that, as I said, make sure they have a blood pressure chart, make sure what their regular blood pressure is when they're not fasting, and also look at the kidney function, because dehydration can cause changes in the kidney function, and many patients with high blood pressure also have kidney problems. And also we have to, the reason I ask patients to maintain a blood pressure chart is because even slight dehydration can cause low blood pressure, and also taking medications while you're fasting can tend to low blood pressure. And that's why it's important to adjust the medication and, as I said, take it at the appropriate time. And this is especially important for blood pressure medications that are like water tablets, because you're excreting something from the body. That's what you call a diuretic. We know that this is basically what we call Lasix as a prototype. These medications need to be looked into in further detail, especially when you're fasting. But having said that, this is a green light. Any patient who has well controlled despite having blood pressure is very safe to fast. How about adjusting it? So we have two classes. So we have these calcium channel blocks, everything that is not a water tablet, basically, which we use for high blood pressure. This is probably best taken at suhoor, especially if the patient is more active, because some of these can tend to cause postural hypertension. So you've been fasting all day and you just break your fast, and if you take your blood pressure medication, sometimes it can cause what we call postural hypertension. So these medications, the calcium channel blocker, that is your nifedipine, amlodipine, losartan, which is an ARB, ramipril, all these pills are generally best taken at suhoor. But if you're taking water tablets, because these will also make you urinate, it's probably best you take it at iftar, and also it will also lend yourself to dehydration, so that is also avoided by taking the water tablet type of medications at iftar. So that's probably best taken then. Patients who have had heart attacks, so if you've had it 1 or 2 years back, it's generally safe provided you take your medicine. As I said, if you have had a heart attack within the last 6 weeks, it's best, or any heart surgery, it's best not to fast. Again, because of the risk of dehydration, and you can't undergo appropriate cardiac rehab, which is necessary for your health. Also, drugs which have a once daily dose can be taken either at suhoor or iftar, while those at twice daily take it at different times depending on the medication, but as with wide a gap as possible. So as I mentioned, one of the mainstays of medications for those who have had heart attacks are blood thinners. And these are names that I put down there so that if there are any patients on the call, they'll be familiar with these drugs. So aspirin, clopidogrel, prasugrel, we take them once a day. So it's safe to take either at suhoor or iftar. But ticagrelor is actually taken twice a day. And as I said, you want to make sure that your blood is always appropriately thin so that the stents don't clot and your blood vessels don't clot. So a medication that is taken twice a day is taken twice a day so that you maintain that appropriate thinness of the blood. So it has to be taken at those correct timings. So when you're fasting, if you're fasting in an area where you have to fast for 18 hours, 19 hours, and you can't take it 12 hourly, it might be considered, you might want to speak to your doctor and switch to one of the drugs that you can take daily. But this is, of course, something that you don't do on your own. You have to make sure that you speak to your physician before changing it. But of course, if it's a 14-hour fast, it might be quite reasonable to take it at suhoor and iftar and continue the twice daily medication. If you're on cholesterol medication, you can take it after meal, after iftar or suhoor. And if you're on an anti-gastric medication, once again, can be taken at any time. And as I said, the sublingual spray, generally it's agreed that it doesn't terminate the fast. What about patients with heart failure? These are patients who don't have adequate pumping. Even in them, the usual pumping function is about 60 to 65%. If it is not severe, if you have a heart function pumping capacity more than 35, you can fast very safely with appropriate medication. But if it is less than that, or if you have one of these shocking devices or a high-tech device called a CRT, it's probably high risk for fasting, and maybe you shouldn't be attempting to fast all of it. And of course, those who have had transplants or who are in advanced heart failure, it's a definite no. What about other devices? As I said, pacemakers are safe, but CRT and ICD are at least high risk, and I would advise caution. But if you're on a pacemaker, you should have go to your pacemaker clinic or your pacing clinic. Make sure you check your device either remotely or in person, and do that pacemaker check to see that everything is well functioning prior to Ramadan, so that you don't have any unnecessary mishaps during the month. Other conditions which you might think are high risk are, as I said, very severe stenosis, that is thickening of the valves that obstruct the blood flow. Those with hypertrophic obstructive cardiomyopathy, as I said again, even before, those conditions that cause the heart muscle to be so thick that it obstructs flow. Also, we have patients who get blue, who have been blue as children, who have had holes in the heart and certain congenital heart diseases, but not all of it. So not all holes in the heart are dangerous. Some of them, which can cause shunts and lead to the patient looking blue, which is what we call cyanotic heart disease. Those are the conditions we would consider high risk, but not all of them. And these are very specialized conditions which you should ideally consult your physician with prior to any recommendations about fasting or not. As I said, blood thinners are very, very important to make sure that they are within that range and appropriate thinness, so you don't want it to get thick. These can be either the aspirin, clopidogrel types, or alternatively what we call anticoagulants, which some patients might be familiar with. They're warfarin, and there are also newer drugs called rivaroxaban and apixaban. So these rivaroxaban, that type of drug, it's recommended that it's taken with the meal, so you have to make sure that it's taken with your meal when you fast. I spoke about antiplatelet drugs before, and there was a question about adjusting diabetic medications. So I'm not an endocrinologist, but we generally tend to see patients. And the key to adjusting medications, diabetic medications, if you consider oral medications, are those that can cause you to become hypoglycemic, which is a lower blood sugar. So there are certain drugs that do that. There are certain drugs that don't make you go hypo. They just maintain your blood sugar at a normal level. Metformin is one of those relatively safer-ish drugs, provided you don't have heart failure and are not too dehydrated. So if you're taking a once daily dose of metformin, either a slow release or an immediate acting drug, if it's once daily, you don't need to adjust the dose. You just take it at iftar. It's always best to take once daily drugs at iftar and not suhoor, because after that you're fasting. Fasting can cause hypoglycemia. The drugs may cause hypoglycemia, so it's best to take once daily diabetic drugs always at suhoor. If you're taking a twice daily, then you don't need to change the dose. If it is metformin, this is only for metformin, not the rest of the diabetic drugs, and take it in the evening and in the morning at suhoor. If it is 3 times daily, often patients take 500 3 times a day. So here the morning dose should be taken at suhoor, but you combine the afternoon dose with the evening dose and take it in the evening, maybe a little lower. So if you have to take 1,000 milligrams, maybe you'll take 750. The other important diabetic drug is what we call a sulfonylurea, which is glimepiride, glibenclamide, all the Gs that you know. And if it is once daily, take it again at iftar. If it is twice daily, so now these sulfonylureas, the glibenclamide, they can tend to lower your blood sugar, unlike metformin. So which is why here we reduce the dose if we take it in the morning. So at the evening dose, you take the same dose that you're taking. So if you're on 30 milligrams, you take it. But if you have to take it twice a day and you have to take it at suhoor as well, consider reducing it by about 25 to 50%. So maybe take half or maybe take 3/4 in the morning at suhoor. If it is twice daily dosing where you have a higher morning and a lower evening dose, here what you do is you swap it so that you take the higher dose in the evening where you're able to eat for a few hours after that. And the lower dose, you take it in the morning, but you reduce it further by another 25 to 50%. And if you take 3 times daily dosing, then you stop the middle dose, you stop the lunchtime, you switch again the morning and the evening dose so that the higher dose is taken in the evening and the lower dose is taken in the morning, once again reduced by 25 to 50%. We have newer drugs called SGLT2 inhibitors. These are the empagliflozins and the dapagliflozins, which are given to diabetic patients, patients with heart failure and cardiac disease, where basically the whole spectrum, even those sometimes with kidney disease. So it's important to make sure, because it's relatively new, don't start it during Ramadan. Initiate it at least a month before Ramadan. And if it has been started at least a month before Ramadan, then you don't need to further change any dose. It should be taken once again in the evening. Make sure that you take enough fluid, avoid hypoglycemia, just like the other diabetic drugs. And it's best avoided in the elderly and those with CKD and also those on loop diuretics, because once again, this can lend itself, taking a lot of drugs that cause dehydration on top of a condition like fasting, which can cause some dehydration, is not the best. So these are the patients that you would ideally avoid, it patients who are elderly, those who are on Lasix, and those in CKD, particularly if they're fasting. What about dose adjustments with insulin? I think this is a bit, if there's a question, this is something, again, you should ideally speak to your physician, because there are lots of types of insulin. There's a basal insulin, which you take once a day, depending on how frequently you take it. There's the rapid acting and all of that, which is probably best done after speaking to your physician. So basically, in summary, I suppose, before Ramadan, it's important to establish the patient's background. What has your previous Ramadan experience been? Have you been able to fast before? Do you have symptoms now? How is your blood pressure now? Are you what's the smoking status? Second, medication history and all compliant you are with medication. How compliant you have been, because it's important to make sure that you take it. Investigations should be the urea and electrolytes, which are the salts in the body, and the kidney function, as well as the heart pumping capacity. These are the tests which should ideally be done in patients who have these conditions prior to Ramadan, and also, as I said, a device check if you have a pacemaker. Then we can risk stratify according to the traffic light system, which I showed. The majority of patients can fast, and we should also make sure that their medications are looked at holistically, so to make sure there are no interactions, there are not too many medications that might tend to process with your physician. Then general Ramadan advice has been very well dispensed already. Make sure that you have a healthy diet, fluid intake, don't smoke. Terminate the fast if you feel unwell, because Allah will understand. And it's also important for your health. And that's the reason why I showed that slide about what is allowed and what is not, because some of it is allowed. You can continue to fast even with that medication, and it's important to be able to know all of that. Also, that intramuscular injection. So if you have a vaccine that's going into your muscle, or if you have something under, break the Ramadan fast. And of course, post the next Ramadan, you make sure that you review that and yourself accordingly. These are the resources I looked at. I'm happy to put them in the chat. There's a very nice resource from the British Islamic Medical Association. The same people have written a couple of papers that are more medical also. And I wrote a simple blog post about a couple of years back on Ramadan and the cardiac patient. I'm happy to put these resources in the chat if anyone's interested. So thank you for listening. Ramadan Kareem, and happy to take questions. Assalamu alaikum.
Walaikum assalam. Thank you very much, Dr. Cader. I think all the questions have been answered by your comprehensive talk. So that was so comprehensive. Thank you very much. And this just goes to highlight how things have evolved from the pandemic days. As physicians, we have all been trained to look after patients with fasting. It's become a different topic. And patients are advised, as Dr. Cader rightly said, it's all about preparation. Prepare before, especially the high-risk ones, and then meet your physicians well before, have a plan, and they can recommend what to do and what not to do. And trial fast, which is very important. You can't have a better month than Shaban to start practicing your fast. And trial fast is very important. So thank you so much for that very comprehensive talk. So now I'm going to start the question and answer sessions. Just to remind again, so I know you briefly touched upon that. I'll come back to you. Might have to answer that question again, the specific one on diabetes separately, Dr. Cader. So I will come to that soon. So we are going to, just to remind, if people in the audience want to ask questions, please raise your hand, and we will answer that, and the tech team will unmute you all. Right. Again, my second tip during the talk is, we all complain of bad breath during Ramadan. So what can we do to reduce it? Right. Avoid sweet, avoid strong smelling food. That will reduce your bad breath to a certain extent. And also food and drinks which contains lots of sugar it's a good medium for bacteria to grow in your mouth. And that will also cause a bad breath. So my tip number 2, so healthy eating, that's all I can say. Right. Now, to the question and answer sessions. Now I'm going to ask Dr. Ayesha Cader to concentrate only on that particular question. I'm going to quickly tell who sent that. This is a question actually from Qatar. One of the brothers asked. I know she has told, but it will be useful to, because we've been listening to that talk, highlight only that issue. So he's asking, a brother from Qatar, he's asking how to manage diabetes during Ramadan, especially longer fasting days. So I know you answered it, but can you just summarize only that bit about, because unfortunately he's not come back to me. I asked him what sort of medication he's on to make our answer individualized or to help him. But he has come back. That's so grateful. Yeah. So he is on metformin, 1 gram twice a day. So this gentleman from Qatar has asked this question, how to manage this. So he's on metformin, 1 gram twice a day. So I think it's easy. If you don't mind starting the question and answer session on that, please. Jazakallah khair. He's actually Brother Hazim from Qatar.
Hi, Assalamu alaikum. I think, yeah, because it's metformin, it's easy. If it's 1 gram twice a day, you just have to look at this middle box here. So I'm assuming 1 gram twice a day would be a slow release. Irrespective of that, you don't need to change your dose modification because it's twice a day. And I'm assuming you're fasting in Qatar, which will not be a very long fast at the moment. It should be, I think, between 13 to 14 hours. So you once and once in the morning. But if you feel like maybe you're not taking enough food at suhoor, it might not be the worst idea to take 750 milligrams in the morning and keep taking the 1 gram in the evening, and make sure that you take it as widely spaced as possible. So immediately after iftar, you should be taking your 1 gram. And just before you, so stretch the suhoor as much as possible to the time of azan. Don't take it 1 or 2 hours before, just so that you make sure you have that adequate duration between the two drugs also. Was that clear?
Excellent. So I don't know whether brother is actually in the program. He can raise hand if he is. Otherwise, actually this is easy. I'm sure his diabetes must be well managed to be just on metformin. Thank you very much for that. And there's another question which we got about few days before the program. It needs a long answer. So Dr. Aseef Yehiyan has already given the answer in his voice message. But since we have a bit time, I'm going to ask, put the question to Dr. Aseef Yehiyan. And this brother can't join. He's not actually in the program because he's in Australia. I think his timing was not good. So he's not. So I will personally forward the answer to him. So Dr. Yehiyan, can I just read that question to you?
Yeah, please.
Okay, so he said, I'm Hamid, age 65. Presently, I'm under medicine for kidney stone. And he also mentioned about gallstone, even, sorry, gallbladder. Yeah, gallstone. So that we might add with his dietary advice. I'm under 6 months medicine treatment per day, minimum 3 liters water. And he specifically says 2 liters sparkling water and 1 liter water. Doctor recommended. Now, almost 1 month, I'm under treatment. Please advise me how to overcome in Ramadan. So you have given a good answer. If you can just reiterate to the general audience, please, Dr. Yehiyan. Thank you very much.
Yeah, I remember this question. Brother Hamid, actually, why I was telling about the kidney stones. The kidney stones, the treatment is, if it is symptomatic, if it is trouble causing kidney stones, what you do, you either laser or you stent or you break it, do all those things. Why you drink water is to prevent further kidney stone formation and then prevent the stones becoming larger. So it's a preventive medicine. So it should not prevent you from fasting. The only thing, the best advice I gave for even the people who are high risk for kidney stones, like the people who drink, the hard waters in Sri Lanka, certain parts of Sri Lanka, like Polonnaru and Adapura, or in the Arab countries where the water is very hard. So those people, make sure during the eating time of from iftar to suhoor, they should keep on drinking water rather than drinking fizzy drinks and all those the artificial sugared juices. They keep on drinking water, and this is really it's a blessing from Allah Ta'ala in Arab countries. If you go to any of the massages in the Ramadan Tarawih, even in the UK, hundreds and thousands of bottles of water is freely available. Just grab, keep on drinking. You can cover 2 liters, as I mentioned in my talk, easily during the eating time. Even, you see, the countries like the temperate countries like UK, Canada, Australia, where the summer is a long fasting, you have very brief time for eating. But winter is very short fasting and long time for eating. So we are in the middle now, but still within 4 or 5 hours, you can easily cover 2 liters of water. So I would encourage you to drink water from the beginning of your breaking fast to until the end of the suhoor, enough amount of water you can. Second is the gallstones. Remember the gallstones, 90% of the time they are asymptomatic, innocent. The people are walking with gallstones without knowing they have gallstones. When they become symptomatic, when they are troubling, they treat the gallbladder out. We do surgeries to take the gallbladder out. However, why they give these gallstone symptoms is the way you eat. Every single one, not only for the Ramadan, even non-Ramadan time, if you have gallstone, symptomatic gallstones, the gallbladder, pitta paikal in Tamil they call is the gallbladder stones. If you eat loads of fat, then the gallbladder is going to contract vigorously and going to cause you severe pain where you need to take medicine to break your fast. So please, even non-fasting time, reduce the amount of fatty, oily, greasy food in your consumption. Then definitely your gallstones will be innocent and you may not even need a surgery at all in your lifetime. So for the gallstones, there's no treatment other than removing the gallbladder. But if you are controlling your diet for the gallstones, even non-Ramadan or whether you are in Ramadan, you have to do the same control, lack of fat. Okay, Jazakallah.
Thank you very much for that. As I said, he's not in the Zoom program. I will make sure it reaches to him personally. Right. So there's another question actually from one of my good friends, Mr. Lias Abdul Wahid. So this is very, very important. He's asking how to maintain physical fitness and exercise during Ramadan. So I'm going to ask Dr. Aseef Yehiyan to, if you can tackle that one, please.
Yeah, I wanted to mention that point in my talk actually, so somehow it slipped off from my list anyway. So the physical activity you should continue. If you are a regular performing person, I would say you should continue during Ramadan also without interrupting. But there are some changes you need to make sure. Why we lose water, why we become dehydrated is either we pass a lot of urine or we sweat a lot, or physical activity. So remember, if we make ourselves very strenuous exercise, we are going to be weaker and we are going to use our reserve energy to burn. So I would say go from your strenuous exercise plan. Now, suppose if you are, if you are making yourself like in a gym, or if you are running, or if you are a regular swimmer, anyway, you can't swim. So if you're a running person for 45-50 minutes and burning, 150 to 100 calories, then of course, then you should reduce it to 20 minutes, a normal, gentle walk. You can do it every single day. In Sri Lanka, now what you can do is you can walk to the mosque for the Tarawih. And even some of these websites, now actually, as Ayesha Cader mentioned, like BIMA, I would like to refer, with permission, the British Nutrition Foundation. That is very, very long, I think more than 50 years old organization, one of the brilliant nutritional advice organization. They have a dedicated chapter for healthy Ramadan. Please do refer. They have everything in this. You know what is, it's not an Islamic actually, but it's a London-based organization, but they have a very, very dedicated, every single food, including what you should eat suhoor, what you should eat for iftar, what you should drink, what you should not drink, how you do exercise. Everything is in the British Nutritional Foundation. That's more than 50 years old organization, dedicated chapter for Ramadan. So I am referring to that one also. They also advise you gentle, or not vigorous walking, gentle walking every single day after your iftar meal. Because after iftar meal, you feel a little bit tired because you were fasting, then you ate, and then your system, now all your blood supply, everything going to focus onto the digestive system to suck out the nutrition. You will feel sleepy, little drowsy. If you want to go and pray, you won't be concentrating. That's absolutely, you may miss the benefit of that. So I would say if you are going to the masjid, try to walk take a single, every Ramadan should change one single point in our life. Now, if we had lived for 40 years, we would have fasted for at least 25 years. 25 good things should have come in our life, 25 bad things we should have left. But very hardly we see people still suffering after Ramadans, after Ramadans, after Ramadan. So I would say, please continue to exercise, gentle walking, nothing other than that, no gym, no cycling, no treadmill, and then no vigorous sweaty exercise, walking for 20 minutes every single day after iftar meal, not after suhoor. And then you are not supposed to do any fatigue or causing exercises during fasting time. Assalamu alaikum.
Thank you very much for that. So that's very important. And we know a lot of athletes, they do fast, Olympians, they do fast. So if we were to take this one step higher for people who are really young people into fitness, what I can say is, starting from your point, because it's important, the timing is the main issues during exercise and fasting is your hydration, and make sure your protein, your muscle mass doesn't go down. So you need to maintain that. So that's a big challenge during fasting. And also you have to replace your muscle energy stores. So this is only for a small population of people who are physically very fit and gym goers and things like that. If they still want to do, you can actually modify it a bit. And very important, what you said was, don't do anything immediately after a meal, because that's going to divert all your blood supply to your stomach, which is busy digesting your food and emptying it. None will go towards your muscles. So make sure you do it after. So midnight is a good time for these people. If you want a brief 15-20 minutes workout is fine. So all your stomach would be relatively got rid of your food. And then also just before iftar, few minutes, because you are going to be replenishing your body soon. I'm not suggesting that you should go away from just before iftar, which is the spiritually or religiously, that's the best time to ask duas and all. But before that, if you really want to take part in exercise, please do it. And also a bit about the food type. So make sure you eat food which stays and digests slowly, rather than in a sugar rush. So I'm coming back to cereal, or sweet potato is a good thing, which stays in your body for a while, like broccoli and all those stuff, which is ready. And don't forget your water intake. And you can do these things with proper timing, and you can maintain your physical exercise and health. Okay, so a few more questions are coming. So there was another question about fatigue and fibromyalgia. So how can I fast with fibromyalgia? I struggle with severe fatigue, so really need to drink lots of water to keep myself feeling well. So, and she's taking a lot of fruit and vegetables. So Dr. Cader actually sent me answer. She's put it on the chat box. And I know it's not your specialty or our specialty, but are you able to just replicate what you said? Then I will chip in, please.
Yeah, sure. So yeah, full disclosure that it's not my specialty, but I think fibromyalgia is actually very debilitating. It tends to make you feel tired even without fasting. So I would say that it's important. I think Fatima mentioned about taking fruits and vegetables. That might give you a quick fix, but it's not going to give you replenishment in terms of nutrition throughout the duration of your fast, which is why I think it's important to supplement that with, as Dr. Ramali said, something carbs or fats like sweet potatoes and the like, so that you make sure that you have sufficient energy to last throughout the fast. And during, and maybe as a sort of efficiency tip, keep the bulk of your work, if you can possibly afford to do that, to the time that you're able to replenish yourself with water after iftar, do the things that require as much focus as you can. At least that's what I tend to do during the fasting. I do the bare minimum of my workload at work while I fast, but the majority of the extra things get pushed down to the time period where you've replenished yourself, your brain has had the sufficient sugar rush it needs in order to be able to focus. So that's really not a very scientific response. It's more like a practical response, I think. But I'd be happy to have Dr. Ramali and Dr. Yehiyan chip in.
Yeah, so quickly, just looks like, I mean, if it is severe, some people could be on steroids for fibromyalgia. I hope this sister is not on steroids. Otherwise, that has an impact. And again, having said that, these steroids can be given once daily, so could be taken either it has to be taken on a relatively full stomach, or it will cause gastric issues. So otherwise, it's just managing and taking rest in between. Dr. Yehiyan, have you got anything to contribute to that question, please?
Yeah, well, as Dr. Cader mentioned, fibromyalgia is, sometimes it's really annoying and irritating condition. It puts the patients down. If they are on adequate analgesia, and then if they can use a slow releasing one, and that will be helpful. And sometimes in this part of the world, what they do is they get some dermal patches before the Ramadan, slow releasing patches like fentanyl and all those things. The pain team will decide if they cannot take tablets. There are patches available, then you can use it, just apply the patch on the day, just Ramadan, so it will slowly release and keep you comfortable and less pain. And you can talk to your GP or your doctor or your pain team and get it organized. That will also helpful to keep you, strong during the fasting. Hope that
excellent.
helpful.
So I'm going to drop another tip, as I mentioned, and take the next question. So we didn't talk anything about pregnancy, breastfeeding, that sort of thing. So since there aren't any questions, my tip will be, it's pretty safe to fast during pregnancy unless you have other health conditions. So the only thing which you should be worried is the first 3 trimesters, when the baby is actually growing, we call it embryogenesis. So you have to be careful, and some people suffer from excessive vomiting and things like that. So it's very safe to fast otherwise, unless you have other associated condition. And also breastfeeding and fasting. It's again safe unless you are at risk of depleting your breast milk, and not enough, you shouldn't fast. And also it is very important, you should regularly breastfeed. Otherwise, if you don't empty your breast milk, it doesn't form. So otherwise you get other issues like infection and things like that. So people who are in that category, they can fast generally unless you have specific issues. And as I said, we'll be around. Anyone wants to ask questions privately, we'll be happy to take. Okay, we got another question about anemia. So anemia and fasting. I think being a cardiologist and a general physician, Dr. Ayesha Cader will be the best to answer that. Can I give it to you, Dr. Cader, please?
Yes, sure. And I think I would agree with what Dr. Yehiyan has also put in the chat. It's safe to fast with anemia because most patients who are anemic are on supplements, the ones who can be on iron supplementation. So this is not the thalassemia subset, but if you have an iron deficiency anemia, you tend to be on iron and folic acid supplementation, which you should continue during your fast. And as long as there is no active bleeding, if the anemia is caused by, say, an active rectal bleeding or any sort of bleeding, vomiting, of course, you can't fast. But if there is no active internal or external bleed, it's safe to fast, provided your hemoglobin is also at a reasonable level. So it's safe if it's over 6 to 7. I know that's quite low, but just a little over 7-ish is still safe to fast with the adequate supplementation, I think. And also make sure that your food intake dates, as Dr. Yehiyan has mentioned, is very rich in iron. So you can take plenty of dates at iftar and thereafter, and also make sure that your food intake is supplemented adequately with iron, like liver, spinach, and the likes of food that you would regularly take as well. It's safe.
Thank you very much for that. Now, are there any questions from the audience who would like to ask?
If Dr. Ramali, if you permit, I just want to add one more point.
Please, please.
Yeah, because we didn't touch the topic of cancer here. So remember, I wanted to mention just briefly, if you are a cancer patient, if you are on active treatment like chemotherapy or radiotherapy, you'll be extremely weaker, and then, physiologically, and then, mentally, physically, all challenging. I would say ask your oncologist and the cancer specialist, and then try not to fast, because you need significant nutrition, IV drips and all things. But if you had a cancer, you had a treatment, and there's no excuse for not fasting. And also, finally, there are certain cancers, even though we label cancers, those are really, I would say the lucky cancers, I would say, like thyroid, breast, prostate, those cancers, who got it and then cured, people live for 50 years, 40 years without any trouble. So people, you had a past history of cancer, please do fast, there's no excuse. But active cancer treatment, please consider, if you are very weak, you have by all means, religious scholars will agree with us, you have excuse for those patients. Yeah, thank you.
Thank you very much. I also missed that, because very important, because with all this new treatment, the new thing, or not thing, is living with cancer nowadays. I know some are the lucky cancers we can cure, but most of the cancers are living with cancer and then having a quality of life where you can do those things. So it has to be very much individualized. While you both are there, I need to ask you both a question from me personally, but it will be beneficial for everyone else. I'll let Dr. Ayesha Cader answer first, and then Dr. Yehiyan second. Now, we all been busy as health workers, especially during Ramadan time and COVID and Ramadan time. So I personally worked long hours, PPE, wearing PPE, personal protective equipment for long hours. So what sort of tips, or I'm not only medical here, people may have working long hours in other places, in supermarkets, maybe hard work. So what sort of tips can you give them to not affect their performance, physical activity, and their thinking? Please.
So I think, I'm personally a bit of a workaholic. So I also feel like I need to be able to perform at my optimum, and I generally have a lot of coffee. So what I do is I have my coffee at suhoor, so that it works, so it kicks in when I need to, as I go to work in the morning, because not working in the morning is not an excuse. For those who have long hours while fasting, I think it's important to take the breaks, and I think the prayer breaks are very valuable, because it gives you not just a break from work, it's a spiritual break, as well as also you get to have a little bit of rest and away from that, because it can get difficult to focus. It can test your patience also, especially like jobs like ours, where you have to speak a lot. It can be quite difficult. So I think it's important to rotate. We are lucky if you work in countries where the hours are less. Like, I'm currently based in Bangladesh, so it's not like when I was in Sri Lanka. We have fewer hours to work during Ramadan, but at the same time, because of the work I do in different time zones, I have to do all the focus work after iftar. So I think it's also about good time management and getting adequate sleep. So as much as you would want to stay up for Qiyamul Layl every especially on the last 10 days, this is something that I think you have to sort of balance. If you have to go to work the next morning, it's not a thing you can do the whole night, or maybe you arrange your leave accordingly, because I think it's important to manage the time and get adequate sleep as well as food. I don't know how helpful that was, but.
And we are lucky. I'm sure most of, maybe unless it's a rare occasion, most of the employers, when it comes to Ramadan, they know what our needs, and they will be very lenient on any breaks and things like that. So that's Dr. Yehiyan, any tips from you?
Well, yeah, as you said, the whole world.
Surgeon, I'm sure you may be operating something all day.
Yeah. So as the whole world knows about this Ramadan, thanks media, alhamdulillah, has spread the message. So most of the institutions, most of the working places, they really, be lenient, flexible in your working hours and what sort of jobs you do. If you are working under someone's, and then if you are independently working, you can organize your own time, as Ms. Cader, Dr. Cader mentioned clearly. The last 10 days is if you can swap. So in my opinion, so normally the equatorial countries like India, Sri Lanka, South India and all, they will have only 12 to 14 hours fast, and their working schedule is very minimal. Very hardly they meet with these issues of long hours working, unless the drivers sometimes. But the temperate countries now, like Arab countries, absolutely, they reduce the workload, they reduce the timing and so much excuses. But in these UK, USA, when it comes to summer long hours, so I would say you all would have experience in your lifetime. There is a blessing in it. When I am fasting, then when the colorectal list or any major list going on, sometimes our surgery goes for 3 to 4 hours. If I am not fasting, after 2-3 hours, I get thirsty, hungry. But when I am fasting, alhamdulillah, even the 4-hour surgery will finish. Even I know that I can, because mentally we are prepared. We cannot eat or drink. So what happens is our signals overcome that. As I told you briefly earlier, the hormone ghrelin comes from the stomach wall. It lasts only very few minutes. To be honest, the hunger pangs, the hungriness will come, and then immediately it disappears. Then you overcome it and you won't get it back again. You will feel it. But the satiety hormones, the opposite ones, are lasting longer. When you eat, you will be a fed status for a long time. My advice for the people who are working longer, please do not fill your stomach in the suhoor, thinking that is going to help you, and reduce high fat containing food in the suhoor. And starchy carbohydrate, actually the curd or the yogurt is really good, and water rich foods, and that will, even small quantity, and then you will after a few hours is going to go. Whether you eat a lot or small, your hunger pang going to come at time when you are the ghrelin is secreting, your stomach is emptied in hours. So do not fill the stomach thinking that is going to help you until the iftar. That is a major myth people use. They fill and fill and fill and up to the throat, thinking that I can easily sleep and wake up and go to work. No, you won't be able to work at all. You will be so tired, exhausted. Your digestion system needs so much water to digest, and to create stools in our bowel, all 6-meter bowels, we need a lot of water to put it inside. So we eat a lot. We create our burden inside, and then we suffer during the Ramadan. Have a light meal, good fruits and vegetables if you can. See, I remember my grandma used to make everyday lentil, in Sri Lanka, the red lentil. I used to wonder why this lentil coming every day, suhoor. But now, if you read about the benefit of lentils, the dal, oh my goodness, the pulses and dals and nuts, so much good in it in the Ramadan, in the suhoor. People have lost those the good habits. So I would say, do not fill your stomach in suhoor, and then plenty of water and water-rich food, and still you are spiritual and you are psychologically you are prepared not to eat, not to eat, not to drink, not to eat during the long working hours. I personally do is I swap my night on calls, I swap my long working hours because that's the only option. In 11 months you work, you have plenty of colleagues. So I always swap. The last 10 days, I always take basically kind of off. And before Ramadan, 5 days, after Eid, before and after Eid, 5 days, I always take off. I have enough annual leave left. So I make it my point like that, because it's difficult. And if you don't sacrifice your leave for this, and what else you're going to use it for? So my advice is swap your long shifts and then adjust accordingly, and just prepare yourself for. Prophet ﷺ prepared himself 2 months before the Ramadan. From the Rajab, Sha'ban, he prepared. What is the preparation? We are working until the last day of Ramadan, and then only are thinking, oh, we need to buy this. And some people even not even bought dates for the iftar on the day of the Ramadan, first day. Our preparation is very poor. May Allah forgive our shortcomings. But I'm telling you, you prepare, plan ahead 2-3 months before you put it to your leave applications and swap it. And then you will be able to work throughout Ramadan, even it is long shifts.
Jazakallah, very useful. I'll be wrapping up the meeting in about 5-6 minutes time. Just to add on that, as you said, I also change during Ramadan. I like you, I work in ICU and anesthetic. So one of the common things my colleagues ask me, how are you able to concentrate? How are you doing this? You are not eating or drinking anything. And does it not impact your patient care? So what I realize is actually I work actually better, because you don't have to go for breaks. You just carry on. You do more cases during that time. And also, I've changed into cereals after coming here to UK. So it's made a big difference. There's no carbohydrate rush. You don't feel hungry by noon. And then it gives me a nice long day, and I don't even stop any of my sports activities. So that all due to small changes I've done. So I'm going to come, because we have been nearly 1.5 hours now, 90 minutes. So I'm going to wrap it up now, and I'm going to thank everyone. Thank you so much. First of all, speakers, Dr. Aseef Yehiyan and Ayesha Cader. I know you are busy professionals, and thank you very much for spending this couple of hours with us. And may Allah bless you and accept your fasting and during this noble month. And also, can I say a huge thank you to the media team? They worked very hard, and without them, this wouldn't have gone this smooth. So thank you, everyone. I can't remember all the names because I'm new as well to the team. So thank you, everyone, for that. And also special thanks to Mr. Wahab Chairman. He worked a lot behind the scenes to get this going. And then also Sheikh Ahmad Yasir, who helped us with the Qiraat, and all the media partners in other countries. Sorry if I didn't name everyone, from Qatar, Australia, UK, everywhere. I can't name everyone, but everyone who helps this making this publicity. And also special thanks to the team which did the flyer. Thank you, everyone. And finally, thanks everyone who participated. And we are going to conclude by salawat. And I'm just going to stay for a couple of minutes here. When anyone wants to ask me anything privately, same, if you all are happy, and then otherwise we'll just conclude. Okay, shall we do the salawat now, please?